Hello, thank you for joining me on Awakening with Russell Brand. As you know, on this channel, I like to focus more on the spiritual aspect of our lives while acknowledging that spirituality and political activism ultimately come from the same place. And if we don't awaken spiritually, how can we change the world? That's why conversations with great men like Gabor Maté, great people, but Gabor Maté is a man, are vital and necessary. I had a wonderful 1 hour long conversation with him. If you want to see the whole conversation, it's available on Stay Free AF, which is my members community that you can click on right now. In this part of the conversation with Gabor, we talk about the nature of addiction, how common addiction is. If you're not an addict yourself, you know someone who's suffering from the disease of addiction. And of course, the reason we're doing this is because it's Addiction Week. We're drawing attention, raising attention to the subject of addiction. But for me, every day is Addiction Day. Every week is Addiction Week. Add the month or year or whatever. If I get to December the 13th, I'll be 20 years clean and sober from drugs and alcohol. And it's because of the support of groups, a set of principles and mentors like Gabor Maté that I'm able to stay clean. In this part of the conversation, Gabor talks about trauma, which is an aspect of addiction and alcoholism that's often overlooked. He talks about the nature of the behaviours. He looks at what addiction does for the person. And I must say, it's a fantastic conversation. If you want to see it in full, join us over on Stay Free AF. But please enjoy this part of the conversation.
Now, it seems like you're willing and able to underwrite the more complex aspects of mental health diagnosis with these physical examples. What else are you demonstrating in your book, The Myth of Normal? I know because I've read bits of it, well, the bits where my name's in it. I've read loads of it. What else are you talking about when it comes to like addiction and mental health and the social and political aspect of these conditions?
Yes. So, again, the addiction assumption in society in general is that it's a choice that people are making. In fact, the whole legal system is based on the assumption that people are choosing to behave in certain ways, consciously choosing. So they're consciously choosing to become addicted to illegal substances. That's the assumption in the legal system. Therefore, I argue that when we call it a criminal justice system, it's a really good name for it. It's a criminal justice system because it's criminally stupid in its assumptions. I've never met anybody, and I've worked with really hardcore substance users, who actually woke up one morning and said, "Oh, my ambition is to become a drug addict." That's the first point. Second point is that the medical assumption that we're dealing with an inherited brain disease is equally false. So that there's very little evidence, despite what they say, for any genetic causation of addiction. What we're really looking at, and let's just do a little experiment here. I'll give you a definition of addiction and get you to participate. I'm speaking to the audience here and also to my interviewer. I'll define addiction as manifested in any behavior in which a person finds temporary pleasure or relief, but suffers negative consequences in the long term and doesn't give up despite the negative consequences. So pleasure, relief, and craving in the short term, harm, and inability to give up in the long term. Now notice I said nothing about drugs. I said any behavior. So it could be substances, cocaine, crystal meth, caffeine, nicotine, whatever, alcohol, heroin. Yes, also gambling, shopping, sex, pornography, eating, self-cutting, anorexia, bulimia, work, internet, gaming, extreme sports. The issue is not the behavior as such, it's the internal relationship to it. If there's craving, pleasure, and relief in the short term, harm in the long term, and you're not giving it up, you got an addiction. I don't care what to. So here's what I'm going to ask here from the audience is if by that definition, you recognize that at one time or another, you've had any kind of an addiction, just raise your hand. Okay, so what we've got here is the vast majority, if not everybody. Okay, now here's what I'm going to ask you now. I don't know if this works for the podcast purposes. I'm going to ask some of you to tell me not what was wrong with your addiction, which you already know, but what was right about it. What did it give you in the short term that you craved, that you wanted?
We'll cover that later, right? Just for the structuring and production of our podcast, because that is one of your great edicts and one of the what I would call Maté's maxims. That I've coined that. When analysing addiction, I talk I'm in a program of recovery. I talk to other addicts all of the time, and it's a very helpful tool to invite someone that is dealing with chemical dependency or any form of addiction. Don't don't assess the many negative consequences of addiction. Look at what it does for the addict, the positive purpose that it serves.
Right.
It's yours, and I like it. I use it all the time, and I usually credit you for it, depending on if I'm trying to impress the person or not. When I'm with my own behaviors, I'm looking sometimes for connection, distraction, a sense of self-worth, validation, escape. These are all motivations.
So escape from what?
Pain.
Right. So hence my mantra, not why the addiction, but why the pain. And so what I'm saying is, just as you've articulately illustrated, the addictions, these qualities, connection, self-worth, pain relief, are they good things or bad things?
They're good things.
Yeah. In other words, addiction, the addicted person just wants to feel like a normal human being. So addiction is neither a choice, nor is it a disease. It's an attempt to solve the problem. And that problem is rooted in trauma. So once we recognize that, why are we judging people for desperately seeking to escape states of extreme emotional distress, isolation, disconnection, pain? So the addiction is not the primary issue. The primary issue is the trauma that induces the mind state from which the person needs to escape. And now if you look at it from the population and the political point of view, like for example under COVID, just to give a recent instance, alcoholism went up. Addiction, drug use went up. All kinds of addictive behaviors went up. Why? Because when people are stressed and they have not the means to resolve their stress, they'll resort, amongst other things, to addictive behaviors. Now that has all kinds of political implications. Because if you look at least in the United States, and I bet if you did a class analysis here in Britain of who's in jail because of addictions, addicted-related behaviors, in the States it's largely minority people by a huge disproportionate percentage. In Canada, 30% of the people in our jails are Indigenous people. 30% of my clients in the addicted area of Vancouver where I worked were Indigenous people. They make up 4% of the Canadian population, 30% of the jail population, and Indigenous women make up 50% of the Canadian jail female population, 4% of the general population. What are we looking at? We're looking at historical oppression and trauma and ongoing racism. And that's what manifests in that need to escape. Now, does the medical profession take that into account? Does the legal profession even know about it? We just keep punishing people for how we make them hurt. We're punishing people for how we made them suffer. And I bet in Britain here, if you did a class analysis of who's in jail, it's not going to be the upper crust.
Did you enjoy that conversation with Gabor? We actually did that live here at Stay Free HQ. And the audience were brought in on the back of a tractor. That's not even a lie. These are the kind of events we do. And if you're a member of the Stay Free AF community, you will be invited to participate in those events, as well as being able to watch full conversations with Eckhart Tolle, Jordan Peterson, Brené Brown, Vandana Shiva. Brené Brown's not been recorded yet, she's coming soon. We've got some fantastic guests on the show, with Jocko Willing, just amazing people come on. So join us over there on Stay Free AF. As I say, there's a link in the description. Thanks for watching this, and if you are an addict or you know someone that's suffering from addiction, I hope this conversation was useful. Remember, also on Stay Free AF, I do meditations, and I did a meditation this week on tackling the thoughts that lead us to addictive and compulsive behaviour. Hopefully I'll see more of you. Thanks for joining us here. I love you. Stay free.